my name is Wendy. I'm one of the technicians here at Mount Laurel Animal Hospital. We also have Mikey here with us today. He's going to help us out and help demonstrate on how to give subcutaneous fluids to our cats. Cats generally are prescribed subcutaneous fluids for many different reasons, most commonly just to kind of maintain or boost up their hydration. Supplies that you will need is one, a fluid bag. A fluid bag has units or increments numbering all the way down the side of the bag. Each number is 100 mLs, so from 1 to 2 is 100, from 2 to 3 is 100 mLs, from 3 to 4 is 100 mLs. Most cats generally are given about 1 to 200 mLs at a time, depending on the size of your cat. You also need an IV line. The IV line gets attached to the fluid bag, which I'll show you in a moment, and then also needles. Needles do come in different sizes. Typically, it's recommended to use an 18 gauge. To start, we can open up the packages. I removed the bag that contained the fluids. So I'm going to open up the IV line. So a lot of these parts here are sterile, and we do want to keep them sterile. Underneath this cap is sterile, so we don't want to drop this down or touch it on the floor. Or even with our fingers, because we don't want a source of infection. So once we remove the cap, we want to hold on to that until we're actually ready to puncture the fluid bag. The fluid bag has a little pull tab here, and you have to pull somewhat hard to remove that. And there is a seal, so the fluid won't come running out. You could take your end, and then we're going to put it directly inside the fluid bag, and you do have to put a little pressure to it and a little twist to it to get the base of the fluid line all the way up to the base of the bag. The fluid line has a couple parts on it that I want to show you. There is one here that can actually pinch the line or open the line. There also is a wheel that we can use to either close the line by pulling it, rolling it down, or we can roll it up to open the line. To start, we do want to leave all of this open because we want the fluid to run through all the way down to the end of the line, which is right here. Once it reaches the end of the line and we get most of the air out, we can either pinch it off here, or we could use the wheel to tighten it. One or the other is fine. It's not necessary to do both. When we are getting ready to give the fluids, we do want to hold this up high because gravity does help bring the fluid down. You want to place the fluid bag higher than where your cat will be. So I'm just going to use this hook that I have here, which I can put on top of a cabinet. Things around the house, you could use a coat hanger, maybe over a door. Door hinges also work pretty well. You could do something like this. That's fine too. Right here, at the end of the fluid line, there's a little plastic cap. This is also sterile. So we're gonna go ahead and remove that. So again, we do not want to drop this or touch this on the floor or touch this with our fingers. We want to keep it clean. We'll grab a needle, and these needles just twist off. Also with a sterile area, we're gonna connect the two. And then there's this little locking mechanism right here that we can just slide over the top of the needle hub and locks it in place so it stays tight. The needles sometimes come in a little paper wrapping that you can peel off. This particular one was just plastic capped. We have Mikey here. Mikey's going to help us show you how to give some subcu fluids. And I normally recommend doing it in a place where they can't get away from you, especially if you're going to be doing this by yourselves. Maybe on an elevated surface, a countertop, on your lap if your cat's most comfortable there, or even on a kitchen table. You can definitely provide some things to keep him steady and distract him. So I'm just gonna, I don't know if Mikey will want some, but I'm gonna have some handy here for him. And generally, giving subcutaneous fluids is pretty quick, so it shouldn't take a very long time to give. And sometimes it's handy to maybe do it in his cat carrier. You can pop the top off if your carrier is one of those types and just let him sit in there. You do want him to be comfortable. He shouldn't be trying to get away from you because that's not going to make your job easy. So I'm going to grab my fluid line. The needle has a cap to remove here, and then we have the sharp needle right at the end of that. And we do want to keep this sterile again, so we don't want to drop it on the floor. If by chance we do drop this on the floor, or if it touches a dirty area, we should replace that needle before actually using it on Mikey. The best place to give subcu fluids is right up in this area. They seem to be less sensitive around here, and also they do have a lot of extra fur, or a lot of extra skin, loose skin, which helps. When inserting the needle, lift the skin up a little bit. When you lift the skin up, it pulls, if you pull up the skin, it makes an L shape. This is where we want to go, right into this little area. We don't want to go completely straight across, because it is possible for the needle to go into the skin and then out the other direction. And then if that is the case, fluid would just run out when you do open up your line. So we do want to aim down just ever so slightly, maybe less than a 45-degree angle. So I'll lift up the skin a little bit. We'll have a nice little pocket right there. And then, boop, I usually go pretty quick because they seem to feel it less. If you do enter slowly, they may feel it a little bit more and then become agitated. Once I have the needle in place, I'll open up my fluid line. And in this case, I used this little clamp. I check the area just to make sure the fluid isn't coming out the other direction, which it looks like it is not. The needle you should put all the way up to the hub, into the skin. There you might see a couple little fluid or little air bubbles going in. Oh, sorry, Mikey. The fluids are a little bit cold, so they might react just like Mikey did, and his skin might twitch a little bit, but the process is generally very quick, and it should be over in a minute. If we look over here at our fluid bag, we can see in the port here that the fluid is running. Sometimes you might see the fluid run a little bit slower, like, let me see if I can slow it down, like that, like a slow drip. So you do want it to run fast because we do want it to go as quickly as possible. If we do see it dripping pretty slow, all we can do is just maybe readjust our needle a little bit without pulling it completely out of his skin. We have given the amount of fluids that we're supposed to. We can clamp off the line or use the wheel. Whoop. He's taking it out himself, and that can happen too. But when removing the needle, all you can do is just slide it out. It would be normal to see some of the fluid running down his fur. You also might notice that you might see a little bit of red, or just from where the needle poked him. He has this nice fluid bubble here under his skin. Sometimes it could resemble more of like a camel hump. Sometimes this fluid bubble might even flap off to one side or to the other side, and he might look a little lopsided, which is also very normal. This should be absorbed by him, and then it will go down usually within the next couple hours. It's in good habit to remove your dirty needle and actually put a clean needle on the end, just so you're ready to go next time. There's also bacteria on here just from poking with his skin. We just want to rule out any possibility of contaminating the rest of the fluid bag. So again, we could just twist that up, pop that back on there, and then we're good for next time. Also, we could use one fluid bag for multiple dosing. So if we are giving, let's say 100 mLs at a time, this should theoretically last for 10 dosages. We could even take a pen. You could take a pen to even mark where the fluid stopped. So I'll say we stopped roughly about here. So if we wanted to give another 100 mLs next time, we would roughly go about here. All right, Mikey did great, and yeah, thank you for watching. And if you have any questions about this at all, please don't hesitate to give us a call. We're here every day at all hours. Yeah, we'll be here for you. Thank you, Mikey.